Today's topic, when is it right for a nurse to go on strike? Did you know that when nurses go on strike, hospital death rates increase by almost 20%? This is the finding of a study titled, Do Strikes Kill?, which analyzed data in New York State over a 20-year period of time. In other words, when nurses decide to strike, patients die. This reality needs to be carefully considered by both the nurses union and the management before even authorizing a strike and then choosing to walk out or close down further negotiations. Though collateral damage of the death of innocent civilians is accepted in a time of war, when is it ever right to tolerate the loss of innocent patient life as collateral damage because of a nurse's strike? What if a patient who needlessly died during a strike was your grandmother? Would this be acceptable collateral damage to you? I don't think so. For example, when the Auto Workers Union decides to go on strike over a conflict with management, the assembly line stops, car manufacturing is delayed, and nobody gets hurt. But the professional nurse is not a blue-collar worker on the assembly line, but a healthcare professional who is caring for human beings of infinite value and worth. This responsibility to our patients must be carefully considered before a decision to strike is made, because human lives can be adversely impacted. In fact, the American Nurses Association, our code of ethics that guides the behavior and conduct of nurses, and this has the same patient-centered standard that states in Provision 2. The nurse's primary commitment is to the patient, whether an individual, family, group, community, or populations. In other words, as a professional and patient care advocate, the nurse's primary commitment is to the patient, not the nurses' union. Provision 3 of this same code of ethics goes on to state, the nurse promotes and advocates and protects the rights, health, and safety of the patient. Knowing that the consequence of a nurse's strike can and will directly impact the safety of patients, is striking behavior consistent with how a professional rolls in practice? I believe the answer is obvious. In most cases, striking is unethical and unprofessional behavior becoming of a nurse. So when is it right to strike? Well, guided by the nurses' code of ethics of our profession that places the patient at the center of all that we do, the reason to authorize a strike and to follow through should also have core concerns related to the patient and safe patient care. For example, if hospitals want to extend patient care ratios that are unsafe in order to decrease costs, this boundary is unacceptable and needs to be confronted by nurses. But if the primary issue is wages or benefits such as health insurance, I believe these are secondary issues and not a reason alone to authorize a strike and walk out knowing that patients will be put at risk. Reflect on, why did you become a nurse? If you're a student or nurse in practice, reflect and ask, what was your primary motivation to become a nurse? Was it to serve and care for others, or have a high-paying, recession-proof job? What I have observed with some is that because of the high salary and numerous benefits, the primary patient-centered motivation can shift, and nursing becomes all about me. How will it benefit me or my rights? This is the essence of entitlement that is endemic in our culture. You don't believe me? Look at the picture on the screen. This nurse has a sign that states, on strike for what's right. What's right? Look closely at the back of her shirt that the nurses union handed out to those crossing and to those striking. RX, or which means prescription, your rights. Let me share my story. For the first time in 33 years of clinical practice, the nurses union that represents the nurses at the hospital that I work at here in Minneapolis decided to authorize a strike and follow through with a walkout over the primary issue of reduced coverage of health insurance benefits by our employer. But the ethical principle of primum non nocere, Latin for above all, do no harm, is foundational to medical, nursing, and corporate ethical practice. It is time that both nursing unions and healthcare corporations recapture a vision and mission that places the patient first, not just in words, but their actions and how it is lived out. And if what I have shared resonates with you, do me a favor and share this with others to let them know that they are not alone.